We discuss interviewing for somnolence. Somnolence means dozing off frequently in the daytime or early evening. Some Chinese books also add that the patient wakes up as he or she breathes out and then dozes off again. Somnolence also includes some people's physiological need of sleeping a longer time than normal, which in adults is approximately 7 to 8 hours. Somnolence may be due to a deficiency, usually of qi and or yang, or to an excess such as dampness or phlegm. The most common situation is a combination of a deficiency of spleen and or kidneys and a full condition consisting of dampness or phlegm. Of course, when the patient complains of somnolence, one should first inquire about the patient's working hours. If the patient works very long hours, a very common occurrence in Western industrialized societies, somnolence is then not a pathological symptom. So here are the patterns for somnolence. Spleen-yang deficiency. The somnolence will be associated with desire to lie down, loose stools, pale tongue, weak pulse. For kidney-yang deficiency, the somnolence is accompanied by listlessness, backache, dizziness, tinnitus, pale swollen tongue, deep weak pulse. For somnolence due to dampness, there will be somnolence after eating, feeling of heaviness, sticky coating, slippery pulse. Somnolence due to phlegm, there is somnolence after eating and in the morning, muzziness of the head, dizziness, swollen tongue with sticky coating, slippery pulse. Spleen-yang deficiency with dampness, which is somnolence especially after a meal, there will be tiredness, feeling of heaviness and muzziness of the head, feeling of heaviness of the limbs, poor appetite, epigastric fullness, sticky taste, no thirst, loose stools, feeling cold, cold limbs, pale and wet tongue with sticky coating, soggy pulse. This is the most common cause of somnolence. Acupuncture points, REN 12, stomach 36, spleen 6, bladder 20, bladder 49, REN 9, REN 5, bladder 22, DO 20, and moxa. For spleen qi deficiency with phlegm, there will be also poor memory, slight depression, mental confusion, feeling of heaviness and muzziness of the head, feeling of oppression of the chest, dizziness, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of limbs, loose stools, tendency to obesity. Pale swollen tongue with sticky coating, pulse is slippery weak. Acupuncture points, REN 12, stomach 36, spleen 6, bladder 20, bladder 49, stomach 40, REN 9, REN 5, bladder 22, and DO 20. For somnolence due to spleen and heart qi deficiency, there will also be poor memory, slight depression, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of limbs, loose stools, palpitations, shortness of breath on exertion, pale tongue, empty pulse. Acupuncture points, REN 12, bladder 20, bladder 49, stomach 36, heart 5, bladder 15, and DO 20. For somnolence due to kidney-yang deficiency, there will also be poor memory, lower backache, cold knees, feeling cold, bright white complexion, weak knees, tiredness, lassitude, abundant clear urination, urination at night, impotence, decreased libido, pale and wet tongue, deep weak pulse. Acupuncture points, kidney 3, bladder 23, bladder 52, REN 4, DO 20 with moxa. So for somnolence, we always use DO 20 to help the patient. Thank you very much for your attention.